All right, I am Jonathan Citow, Neurosurgeon. I am part of the Advocate Condell Orthopedic and Spine Institute here today to talk about concussions. The main thing about concussions is number one, prevention, and much more important, diagnosis and treatment. The key to prevention is good body mechanics learned hopefully through your athletic trainers. For example, if you're tackling somebody in football, the key is to keep your head up like this and tackle as opposed to putting your head down and sparing, something that Doug Plank of the Bears used to do on a regular basis. But now those methods are becoming illegal, and Matt Forte even complained a little while ago that once the running back is carrying the ball past the line of scrimmage, he's no longer allowed to put his head down and ram his way through. That's probably best for all parties involved. So when you have a concussion, a lot of times you might not even know it. What happens is you hit your head, your brain shifts around inside your skull, bangs into either the side of the skull where there is impact or the opposite side, and temporarily doesn't function at the appropriate level. So the player will come to the sideline and look totally normal. The key is that he appears dazed, he's not quite right. And it's very important that someone on the sideline is trained to look for this and ask him very simple questions. For example, who are we playing today? Who scored last? What is our record? And things of that nature. And if he gets all those and he looks totally fine, sometimes the coach will put the player back. But the problem is that if the concussion goes unrecognized and you get back in and continue to play and you have a second head injury, that one can be much, much more devastating and cause significant problems, including brain swelling and even death. So it's important that all athletes in contact sports have a baseline evaluation to determine their level of function with specific questions. If there's any question about a concussion, it's very important that this player be taken out of that game for the rest of the game. If it turns out that he is at his baseline, then as soon as he is asymptomatic, he can return to play. If he's having symptoms, headaches, nausea, vomiting, lethargy, dizziness, vertigo, any of these, he cannot return to play until they're completely gone, because if he does go back and get a second injury, he is at much, much higher risk of having a permanent problem. I hope that these tips can help your student athletes stay safe on the field. Thank you.